Well, welcome to this webinar on health misinformation, mechanics, impacts, and countermeasures. I'm Aaron Carroll. I'm the president and CEO of Academy Health, and I'm pleased to host this webinar along with the ABIM Foundation, which is going to discuss the ongoing challenges of misinformation in today's healthcare environment. We have two panelists who are going to discuss their work in addressing misinformation, including the psychological mechanisms driving science denial and how centering equity and community can strengthen efforts to mitigate the harms of misinformation. Our first speaker will be Sarah Gorman. She's the chief executive officer and co-founder of Critica. Critica's mission is to develop and test new methods of advancing public acceptance of scientific evidence and promoting informed health decision-making. Dr. Gorman is a public health and behavioral science expert who has published 2 books with Oxford University Press on science denial and misinformation. Her work has been featured in a wide array of media outlets, including the BBC, NPR, New York Magazine, Science, Scientific American, and The New Yorker. Our other guest will be Reed Tuckson, who is the co-founder of the Black Coalition Against COVID. The coalition is a multi-stakeholder and interdisciplinary effort working to mitigate efforts of the COVID-19 pandemic in Washington, D.C. and across the country. Dr. Tuckson is also co-convener of the Coalition for Trust in Health and Science, working to unify the healthcare industry and combating mistrust and disinformation. Previously, he was executive vice president and chief of medical affairs for United Health Group, served as senior vice president for professional standards of the AMA, and was commissioner of public health for the District of Columbia. Now, before we begin, just some logistics for this webinar. Participants, meaning all of you watching, are muted during the webinar. We encourage you to use the chat feature, however, to share general comments with the group throughout the webinar. To submit a question, though, please enter it into the Q&A feature on Zoom at any point during the webinar, and we will address the questions during the discussion portion. Finally, we will be recording today's webinar, and it will be posted online, so please do feel free to share it afterwards. So turning to our panelists, and I would like to start with Sarah, but I'd like each of you to answer this. Can you provide a brief overview of your work on misinformation and trust and what we can learn from it? We'll start with Sarah.
Sure. Hi, thank you for having me, and good afternoon, everybody. So as Aaron said, I run Critica, which is an organization that focuses on developing and testing new methods of counteracting misinformation, mostly focusing on social media, although we have some projects that look at misinformation in the real world. And our chief contribution in this area is that we've developed a methodology that we call community-oriented motivational interviewing. And as the name suggests, it's heavily focused on motivational interviewing, which, if you don't know, is a methodology used in psychology, really originally developed to treat addiction, that focuses on developing common ground and unearthing ambivalence to really move people toward behavior change. And so we utilize this method in instances where people are sort of expressing misinformation on social media. We have people that we call infodemiologists who go out and intervene in these settings and use motivational interviewing to talk to people about why they're believing the things that they're believing and how to sort of get out of that pattern. And they also they build community as a way to sort of reinforce that the community expects a higher level of information hygiene. So that's the main intervention that we've developed. We also counsel a lot of other organizations like the World Health Organization and the national academies on dealing with misinformation and having misinformation initiatives as well.
Reed, can I ask you the same question? Can you give us a brief overview of your work on misinformation and trust?
Thank you. I remember clearly Easter Sunday 2020, just as the pandemic was really starting to take over. I drew upon my past history as being the Commissioner of Public Health in Washington, D.C. during the height of the AIDS epidemic in the mid-'80s. And there I knew that we were going to be facing particular challenges around misinformation, distrust, and so forth. And so I brought together a group of community activists across the breadth and depth of the city, representing multiple different constituencies. In the course of doing that work, we became very aware that developing a vaccine was going to be key. And of course, that means clinical trials. And so once again, as we began to engage with the community, the first thing out of people's mouths were Tuskegee, Tuskegee, Tuskegee. And I was just overwhelmed by the frustration that in 40 years, we have done nothing in the American healthcare enterprise, the American health, the prevention system, or the policy system. We've done nothing to take Tuskegee off the table in 40 years. And so that led me to bring together the four Black medical schools: Howard, Meharry, Morehouse, and Drew, the Black Medical Society, the Black Nurses Association, among a few others, to really form this national entity to try to go after these issues of distrust and misinformation. I will say that we did our work. We learned a lot from it. We'll probably touch on some of those themes. But when the pandemic was over, I looked up over the barricades and I realized that as bad as the issues were in the Black community, we were able to celebrate that for the first time in history, we closed the disparities gap in primary series vaccinations. And more significantly was that Black life expectancy the second year was better than white America, which I hate winning a race when the other guy trips. So what I began to realize is that this problem of misinformation and disinformation and distrust in the Black community is probably worse in many parts of white America, particularly in red counties and in red states. And so that caused me to realize that this is an American issue far beyond the narrow confines of any one population group. And so we created the Coalition for Trust in Health and Science, asking ourselves very briefly here, is it possible to bring together the entire health ecosystem end to end for the first time in history, given the intense magnitude of this existential threat? And the answer is, to my amazement, from a standing start and no money, yes. 90 plus organizations belong to the Coalition for Trust in Health and Science, and it expands from the American Association for the Advancement of Science all the way through to the hospitals, the docs, the pharmacists, the nurses, the regulatory agencies, the public health agencies, all the way ethics institutes, all the way through to the National Health Council and the National Consumers League. So that's how I really kind of got into this.
And I appreciate both of you answering and giving us information on that, because it all sounds totally relevant. But even before we dig into some of those details, with respect to trust in the healthcare system today, has it changed a lot? In other words, has it gotten worse, or does it just feel worse? Because it certainly feels worse, but there's a real question about whether people do mistrust more or whether we're just more vocal about it. Each of you, what do you think about that?
I think it has gotten worse, and I think a lot of it happened during COVID. I did, for my book that just came out this September, I did about 70 interviews with people all over the country who self-proclaimed as having low trust in the healthcare system. And many of them told me that they were completely trusting of the healthcare system before COVID. And then, they had various frustrations with the system during that time period. And I think a lot of what happened during COVID was that there was kind of a bleeding together for people of different parts of the healthcare system. So they saw the CDC, they saw Fauci, they saw their doctor as kind of all part of the same thing. And so some of the way that we say, okay, it's all right because people trust their doctor, at least they trust their doctor. People started not trusting their doctor as much because they were associating them with these other figures in the healthcare system that they weren't trusting during the pandemic. So I think that there has been a downturn. I think a lot of it does have to do with the pandemic, and I don't think that it's really recovered yet.
I would certainly agree. In fact, I would double down on it. This is overwhelmingly different. Now, the only caveat on whether it is worse now than before is what is the time period. We certainly know if I am not. Oh, I grew up during the era where science was preeminent, where President JFK says we're going to go to the moon, not because it's hard, but because it's the right thing to do. And because it's hard, we're going to do it. I grew up in the era of my goodness. But before that, when I was much younger, before I even got here, there was an awful lot of quackery, misinformation, distrust. I mean, it was all over the place. So, but those of us who grew up in that era of we can conquer problems and we can solve issues, this is much worse. I think it is much worse today also because the health challenges are intertwined so intimately with what's happening in the larger society. You cannot separate out what's happening to us with the tribalism, the fractionization, the overwhelming sense of distrust of elites by so many of our American brothers and sisters, with of course, the rocket fuel of the new tools of social media. All of these things are merging together to make this a perfect storm. And I would say to you that the issues then that complicate this are down to fundamental issues of what is the right of the individual person versus the rights of the state. Those are not new dilemmas. Those are problems that have been long ingrained in the American culture as unresolved issues in the American culture. But this notion of me as an individual versus you as an elite telling me what I can or cannot do is a fundamental fracture point, which is now gained intensity. And now with the new tools and the political benefits that many people derive from this nonsense, this is rocket fuel inside of a very fast engine.
So I'm struck by the fact that, some of the things you're bringing up about arguments about individual liberty versus the good of the collective. These are things that we've been arguing about since the formation of the United States. In addition, as long as there have been vaccines, there have been vaccine denialists and people who are even pretty violent about vaccine mandates. And so there's a part of me that's like, well, this has always been this way. But I do take your points that it does seem to be much worse. And I also appreciate you bringing up social media, which leads me to my next question. How do you think social media has impacted this? Has it made it worse, or is it just made it easier to have the spread of information, and this is a side effect? And also, there are people who believe that social media is the means to fix this. So is that true as well? I'd love for you to just talk about what you think about social media and all of this.
So I think we have to be careful not to blame everything on social media because that is an instinct people have. However, I do think that social media has made things worse. It's not the only factor, but it is a factor, and it's an important factor to take into consideration. Most people do encounter misinformation on social media on a relatively regular basis, and most people are able to ignore it or push it aside. A lot of people don't engage with it. And so on an individual level, your risk may not be that much higher on being on social media to being, exposed and falling into misinformation. But on a societal level, we have this kind of amplification of a risk of misinformation kind of expanding. And the disinformation peddlers who are out there have a much greater platform to stand on. And so that is sort of an existential threat. Um, I would also say that, people who spread misinformation on social media often tend to be, a lot of them tend to be extremist or fringe groups who are really spreading disinformation, like purposely deceiving people. And most people don't, really engage with that. But it does have the capacity to pick on really marginalized communities. And, that is a really big threat as well, to the extent that people are congregating on social media. And the last thing I'll say is that I think it goes hand in hand with the decline of local news and media deserts, that there's really no check. It's very hard to get a check on what's going on social media in the outside media environment. And so that is something that's newer in our age because we're seeing this major decline in the media environment. And I think that that's also a really big threat that goes hand in hand with social media.
I would add to that excellent analysis that, first of all, let's just remember what social media is now about. What it is about is me, and my tribe and my group. And it really is also very much about I ain't you. I don't care about you. I care about me and I care about my tribe. And why is that so important? Because the fight that we're trying to fight here is a fight that basically, especially during the pandemic, was saying what you do can affect others. What you do can kill someone else. do you care? And what we're finding is that there are a much larger number of Americans than most of us ever thought possible who just don't give a damn about anybody else. All they care about is their little world, and their world gets smaller and smaller as social media begins to have smaller and smaller tribes that become more and more vociferous. The second thing is that the whole raison d'etre of social media, the thing that categorizes it, of course, is these influencers, these people who are the stars. Well, those stars somehow or another have now managed to have the same level of credibility as scientists. That the opinion of unlettered, unformed people, people who are not experts, their opinion has more weight in many cases than the robust intellectual interchange of scientific ideas, scientific query, and scientific truth. And so we can't combat that. That the influencer is more important than the scientist. And that becomes a thing to fight. And then third is the tools. There are many well-meaning Americans who do go on social media or self-discovery, self-education formats, who have a well-meaning sense of trying to find out information that will help them make personally appropriate choices and decisions. But as they go down the rabbit hole, they don't realize that the rabbit hole was engineered to direct them from one question into another question, into another question. And before they know it, they find themselves in misinformation hell. And so these are very, very complex algorithms, most of which are well designed. And then you take someone like this Elon Musk person who has this extraordinary ability and who makes no bones about that he will take this extraordinary ability with his website, his social media site, and deliver it into the hands of those who want to do mischief. So there are a lot of factors working against us.
I want to follow up with something that you said in your first point there, Reed, where you talked about that there are more people out there than we thought possible who only care about themselves and their own tribe. Do you think that that is new, or that's just been exposed by things like social media? And if it is new, what do you think has caused that?
I am, old enough to always be reminded that ain't nothing new. And that, these are phenomenon again, that if you go back, there's a wonderful book by Lewis Grossman that really lays out the history of this misinformation world. I think it's called Choose Your Medicine. I would urge everyone to pick that up if you want a really long historical analysis of these things. But is it new? I think it is new in a way that we have never seen it before in the last, since the pandemic. And I think that what it really is boiling down to is, again, this sense that I don't know if any of us can fully explain why elites, so-called elites, have become labeled as that and then fallen out of power. This sense that because those of us who have checked lies and have tried to counter deliberate lies, for some reason those lies seem to have more credence and more import and more personal involvement with large sections of the American people than we would have thought. But this is part of the political movement that is happening across this country. It is very much about a sense of again, this sense of individual entitlement. And finally, I think we have made errors in the health side. We had to learn as we went in the pandemic. When you are facing the reality that these kinds of decisions that must be made to obviate what inevitably turned out to be 1.1 million people losing their lives, 300,000 at least of which should not have died. When you're trying to make decisions with that level of import, then we were very animated in trying to overcome those who resisted that, those who were not trying to save those lives. We knew what was at stake. But somehow, even as we with good intentions engaged in the conversation, we failed to fully appreciate. And even now, I don't think we fully know the answers of how do we bridge this gap between the individual making choices and the responsibility of those of us who are trying to protect and save life. How do we then engage with them? And this is going to be a dynamic that we're going to struggle with for many, many years to come.
Can I just jump in on that for a second? I want to say I agree that I think it's not new at all, because it is the kind of tenet of any charismatic leader that they emphasize in an outgroup membership. That's a really big strategy they use to create a tighter knit group, is to say that's the outgroup and we're the in-group. And every anti-science movement that I can think of has a charismatic leader. Andrew Wakefield, Peter Duesberg, there's like a whole range of them, for all of the anti-science views you can think of. And so it's not new, but I do think that with sort of the rise of identity politics and other phenomena, there's a little bit more of an emphasis on, when you have disinformation peddling going on, there is a little bit more of an emphasis on in and out groups in those settings. So I think it's not new, but it's probably more emphasized than it may have been in the past.
And I would also, I'm glad that you said that. And I would also add that we cannot give, we need to give at least attention to the DEI movement, that the health system was very, and has been for the last several years, very focused on fairness, on equity, on overcoming the social determinants of disease, all of those elements that are associated and are realistically derived from the history of racism and in our country. Those issues having become so politicized, and having this now sense that the anti-immigrant fervor, the anti-affirmative action fervor, all of those things have become a big part, I think, in terms of the pushback from those on the right who really are using that as a cause célèbre, and I think the health issues get caught up in all of that as well.
Do we have any idea of who is more likely to believe misinformation? Is there like a psychological profile or a demographic or something that leads one to be more susceptible to this than others?
We have a good sense of this, a pretty good sense of this in the conspiracy theory world, and in the misinformation world, it's much less developed. I will say, I mean, there's some different papers say different things. There's some evidence that people on the political right are more susceptible to misinformation, that people advanced age and less than a high school education might be associated with more susceptibility to belief in misinformation. But I wanted to caution to be very careful about not just assuming that it's a knowledge deficit issue, because there are so many people who have perfect grasp on the information and still fall into the misinformation, and that's very common. So I think what we really need more work to figure out, what are those psychological profile pieces that make somebody more likely to believe misinformation. And I think we do know so far that an intolerance of uncertainty or change can be very associated with believing in misinformation, as can difficulty with like abstract thinking. But that we don't really have enough, I think, research on this, because I think it would help us target interventions better to people who really need the intervention.
I think that you sort of indicate that one of the big challenges here is the multiplicity of sectors that are susceptible to this. It is those who are poorly educated without high school educations, or those who have a profound level of medical illiteracy, which means that if you say, I've got an mRNA vaccine, oh my God, you're trying to kill me. What is that? And so there is this mismatch between the extraordinary sophistication of our modern medical system with a relatively illiterate science basis of folks. So they are very susceptible. There are the folks who are religious people who are very susceptible to being programmed to this. There are, again, people who are die-hard political, tribal people who will do anything for their political tribe and believe anything that their political tribal leaders say. They are very susceptible. But there's also one other group, and that is, as I look at my experience in the African-American community, we have to really face the reality that many people of color have been treated very poorly by the healthcare system. There's an earned distrust by many people in America. And so they also would be susceptible. And then lastly, we cannot forget the targeting by foreign actors who want to deliberately create confusion and chaos in this country. So the Chinese, the Russians, and others are very involved. And then there are people in the United States themselves who have the ability to promote this, particularly as we now move to disinformation as a service. And so there are companies who you can just buy their sophistication to create and rampant and havoc. And so I think it's a multiplicity, and that's what makes our job so difficult. It isn't just one sector. It isn't just one thing. It is many things. And I come back to the point. The modern healthcare leaders today are going to have to understand the level of intimacy between what happens in healthcare and what happens in the larger society. They are inextricably related now.
So I feel like both of you brought up uncertainty as an issue. And I've often thought that, it's not even just a problem with the public. It's a problem with scientists and people in healthcare as well. We are not comfortable with uncertainty. And we are not very good as well about speaking with the authority that links in some way or is proportional to our certainty. We say things which are proven by massive amounts of huge data with the same level of certainty often as, things that we're just taught or that we have, just assumed to be true. And this also actually, which brings my next question, which actually is very similar to one that's been posted by one of our audience members, and that it's, he says it's too simple to divide the information landscape into just information and misinformation, like truth and false, because there's so much gray and so many areas in which we're doing our best, but we're just not sure. I always think about, when people were like, in Europe, it was stand a meter away from everyone else during COVID. And in America, it was 6 feet. And as if like either one of those was grounded in randomized controlled trials, or we just were giving our best guess, but it was presented as like, this is what we must do. And I worry that kind of certainty, when it is not backed up with real hard data, leads people to question what we should think when we are certain as well. So let me just, specifically ask you, what do we do in a world where so much uncertainty exists to give people advice in a way that is helpful and yet builds trust?
Well, I'll jump in and say I appreciate the question, and I appreciate the thesis of the question because it's absolutely true. The issue comes back to context, time, and place. So in the middle of the pandemic, where I will never get out of my head the body bags building up outside of the hospital in New York. And I cannot get out of my head the number of health workers who were saying goodbye to their loved ones as they went to their duty station and put their lives on the line. And so my point being, the need to act without complete information. The null hypothesis doesn't exist. Okay, we don't know. Do whatever you want. Lots of luck to you. Have a good day. That would have been a disaster for the American people. And so within the realm of the contextual moment, you have to do the best you can. Unfortunately, I wish that we were able to have said to the American people, we are not sure exactly whether it is 6 feet or 8 feet. So let us just be very clear. Let's use this number. This is the best we can come up with. We will continue to learn. The forces of evil would love to just run a truck through that hole and say they don't know what they're talking about. There's no need to distance, even though this is a virus that is spewed from people's mouths and from their nose, and it does travel a certain distance. So even though that, because we don't know the exact fact, are we then compelled to say nothing at all? And so I think this notion of what I'm certainly taking away from this issue is, yes, the need to be transparent with people. Absolutely. But then to be able to help them to weigh the relative risks of the kinds of interventions that we are talking about. And within reason, you would hope that people would make good decisions about that relative risk for themselves. I conclude my point, though, with the point that I made earlier. The problem that I most worry about is in the context of a significant sense of the population who could care less whether they sicken someone else or not. Now you've got the issue of turning this over to saying, we're not sure, we want you to make the best decision you can. But by the way, if you make bad decisions or you just ignore all of this, you can seriously injure people who are vulnerable to you. So we're going to have this challenge, but I will conclude at the end of the day, I think we have to educate American people about risk tolerance. We have to help them to understand what risk is all about, especially now that we live in a genomic era. because the whole element of what genomic medicine will be about is probabilistic statistical decision making. We're going to have a lot of education to do.
Yeah, I would agree with Reed's comments, especially that last part about educating about risk tolerance and statistical inference and all of that. And I do think from a young age, American children should be educated about the uncertainty that's inherent in science. I think there's way too little emphasis on that in scientific education. There was a study out of Finland where they basically had kids in like third grade do an experiment that didn't work out for anyone. That was like the whole point of the project, and that they were supposed to see that sometimes science doesn't go, it's messy and it doesn't go the way that you think it's going to go. And they measured, that these students were able to tolerate this, this feeling of having failed at their assignment because they were well coached by the teacher and, it was all done very well. And so, I think things like that could be really useful in terms of getting young children from a young age used to the fact that science is A, messy, B, uncertain, C, not always, not how you expect it's going to be. And I think just building that intolerance for uncertainty in general can help, like I said earlier, can really help reduce the susceptibility to misinformation. So I think that in particular is very important.
We're going to have to absolutely teach the American children coming up, about the processes of science. Unfortunately, where we are now is that science has been turned on its head. The idea that you would explore, that you would propose a hypothesis and then work to understand whether the hypothesis was correct or not starts to become now, you were wrong. You didn't know what you were doing. You failed. And so I think this sense of we're going to really need to really, and I would say to you that the one place where those who love misinformation and disinformation and want to foment distrust, they're the ones now that are focusing their sights full born on the science, on the secondary science curricula and on science education or education in the secondary schools. And so there, you talk to those folks and they are the teachers of science are in deep trouble with cutbacks in their budgets, and they're in deep trouble as to how they can talk about these kinds of issues.
First of all, I totally think you're both exactly right. But I'm also struck by the fact that that we're all acknowledging in this room that science is messy, that it takes repetition and lots of blind alleys and trying to figure this out. But the way that so many scientific experts in recent years have talked about science, especially when they say follow the science, it's as if science is this amazing computer that you put a question in and you get a very solid answer and it's always the same and we move forward and we should all be in lockstep. And I find that that's the kind of thing that turns people off of science, that they don't get how messy and uncertain it is. And if we really go down the rabbit hole, so much of healthcare is like that. We're giving you our best guess. Like we don't know for sure. Given all of that, what do we do? How do we turn the card around? How do we, get people to sort of counter health misinformation, to sort of be less susceptible to misinformation, and also be willing to extend the grace of there's going to be lots of times where there's uncertainty and we all still have to do our best.
Well, I'll say that some of the things we can do first will be something that would not be easily done on a little perk chart, but we've got to really start to get back to a sense of empathy in America. Because if you don't care whether you live or die, and if you don't care whether the people that you share the same time and space with live or die, none of this matters in the first place. And so if we as a nation are prepared to say, look, 1.1 million people died in a pandemic. Well, what the hell, main thing is don't close the schools or don't close the businesses for any period of time, because you better not mess with the economy. I don't care how many of y'all die. So that's the first thing we got to kind of get to, is a sense that it really matters whether we use information. I think the second thing is that at least one of the things that I'm excited about the Coalition for Trust in Health and Science is that as I'm speaking to you now, I realize that the institutions that are part of us, the entire health ecosystem, there are hundreds of thousands of professionals who who are touching human beings right now all across this country, whether enrolling them in a clinical trial, whether there's a public health official preparing for a community town hall in Missoula, Montana, whether it is someone in the therapeutic arena communicating a therapeutic trial, therapeutic information. We've got to make sure that every single one of those touch points is one that reinforces trust. That is absolutely key. And that just because we may not agree with the person, because they will not take our advice about getting their child immunized against preventable childhood illness, that is not the moment for us to holler and scream at them and wag our finger. It is the moment we're going to have to figure out a way to have a conversation that can go over time. I think the other solutions will be is to be able to arm people, pre-bunking information, so they at least understand the fundamentals of how to make a decision. They learn when they're being misled, being more astute at being able to determine when something is not real or not true, and that false information is there. And then finally, I think we're going to have to do a much better job of how we learn to communicate and talk about these issues. And I think the issue of uncertainty is one that we've just discussed, but I think it's the language that we use, and it's also the willingness to listen to where people are. Narratives are going to be very important as opposed to finger pointing. So there are techniques and tools for how to best communicate. But at the end of the day, the most important thing that we can do is to make sure that every single encounter that the health enterprise has in any way with the American people is one that builds over time or rebuilds over time a sense of trust and a sense of working together.
I don't want to step on your toes there if you wanted to also answer, but I would follow up. But go ahead if you have something that, please go.
Yeah, I was just going to add my thoughts to this question of what should we do. I do think motivational interviewing is a promising avenue, and we have developed a short form that can be used in provider patient interactions when time is really crunched. And so that's something that we're testing out now, including with community health workers. But I think that we need to recognize that the information environment is a social determinant of health. And think about actually, can we screen for that at the point of care as we would screen for any other social determinant of health? And can we counsel people on how to improve their information environment? We also know that when we combine interventions, we do better than when we do them each on their own. So pre-bunking, Reed mentioned some of them, pre-bunking, nudges, media literacy, kind of putting all of these things together in one toolbox and using them together as frequently as possible, because it feels like you're just throwing everything against the wall, but it does work. There is empirical evidence to suggest that it does work to combine these things together and try them in combination. And then, I also think we need to be careful not to just be playing whack-a-mole. That, we're just kind of out there debunking one piece of misinformation just to see another one pop up. And so I think what that really takes, and this is the really hard work, is working with communities to build up, the expectation and the culture that there should be good information hygiene in their midst. And that's the part that I think is a real challenge.
I have to laugh when you talk about the whack-a-mole. I remember when we first created the Coalition for Trust in Health and Science, one of the major priorities that I wanted us to do and was all excited about and armed to do was to work with companies. And there are really great companies out there who are identifying in real time misinformation. They're finding the trends of misinformation, but they're also scouring the literature, the social media world to find them. And the idea was that we would then be able to have credible experts to respond to this misinformation and put it out in real time. And hopefully that would make a real difference. So if somebody said hydrochloroquine for COVID, we would be able to go back with an expert and kind of go forward. And now what we found, Sarah, and just as you've said, is that you do one today at noon, there's another one at 2 o'clock, there's another one at 4, 5 o'clock, 8 o'clock next day, and all you're doing is just smashing these things down. It actually is not even possible to try to counter the number of them. that are happening. And then you have some that you cannot even get at, like the things that come out of Florida with the Surgeon General there, because you can't even get at that because he's a government agency and they have all kinds of freedoms. So my point being is that I think it comes back to your point, Sarah, what I just want to double down on, which is it is very difficult to play whack-a-mole. What you're going to have to do is really go back to the primary root source. How do people learn to read what they're reading? How do they learn to understand the veracity of it? How do they come to terms with it so they at least understand, is there evidence? Is there science? Is there, is there substance to a particular call to action? And then be able to judge whether or not they're being misled or not, and then act accordingly. But the plethora of it is that you just can't attack these individually. It's too many.
So you both brought up really great points. Sarah, with the discussion of, saying that motivational interviewing is something concrete that we can do, and Reed talking about that every clinical encounter should be about building trust. And I couldn't be in more agreement with both of you. But I think about, my life as a practicing pediatrician, where my job was to get kids vaccinated. And I wasn't given the time to do the motivational interviewing because, building trust is not is not something you can easily build. Plus, I'm graded in the quality metrics, not on how much trust do I build, but how many kids did I get vaccinated, which is almost counterintuitive because it's incentivizing physicians to sort of push things down people's throats to achieve the metric, which of course is what everybody wants to get to. So it strikes me that the whole healthcare system is not built to engender and build trust, but that probably is the single best thing that we could be doing. And rather than just be frustrated, what do you think about that?
I know you're trying to be provocative with that, and so I like that because I went back. One of the things I get to do, which is one of the most wonderful things there is I get to give commencement at med schools and other health professional schools, which is so I've taken the Hippocratic Oath like 100 million times. And, when I was at the AMA, the Ethics Institute reported to me. And one of the things that the work that we did there was to sort of reimagine the Hippocratic Oath, for the modern time. And what it basically comes down to is to being a commitment to a lifetime of learning in service to and discourse with society, that there is an implied clear ethic that we have a responsibility to take a lifetime of continuous learning and apply that into not only serving, but also conversation with. I went back the other day and looked at 3 of the oaths in 3 different public health schools in this country. And all 3 of them are united with at least 1 or 2 sentences on our responsibility to work in community, with community, respecting community, listening to community. So my point being is that regardless of whether it is a billable hour or not, it is the essence of the oaths that we took. And there has to be, therefore, a fundamental responsibility. And that trustness can come and has to come organically in the process of the clinical encounter. And so it is not something, okay, I've had the clinical encounter, you've got all your stuff. Now let's turn to talking about trust. No, it is not a separate thing. It is inherent in the process, and it has to be inherent in what happens when that patient checks into the admitting desk at the practice or at the hospital, all the way through to the discharge planning by the care coordinator from the hospital to home.
I laugh because I just gave a medical school graduation speech a couple months ago, and I would say the main theme of it was that I felt like I had been, the things that I had learned is that I felt like I had not been taught to make sure that in every encounter I made my patients' lives better in some way. It was to try to get them to what I want them to do, and that these messages are important, but also timeless. In that it is so much. It's the building of the trust is what cures so many problems, including, I'd say, probably getting us away from misinformation. So I absolutely take your point. I am concerned that we don't have a system which is built to do the important work that we're talking about here. So I'd push back even just a little bit, and I'd love to hear from Sarah as well. Like, what do we do about that? Like, how do we change that?
Yeah, I agree. We don't have the system for it. And part of it, part of it is the time issue, and part of it is the politics, honestly. I wrote a lot in my book about how lack of access to healthcare is something that drives distrust, that it's a huge factor, maybe the biggest factor, including just perceived lack of access, not even just lack of access. Um, Sorry, my screen got dark. Lack of access, real lack of access. But the solution to that, like, would be like universal health care. Is very politically unpalatable in this country. So it's very hard to think of the ways to do this, and it has to be a lot more incremental steps. I do think, and I have proposed this in my book, that there should be trust quality measures. There should be quality measures for physicians that are related to trust building. I don't know, obviously that exactly how do you build those and make sure that they're uniform and that they make sense is not the easiest thing, but I think it could be done. And I also think, just instilling the idea, I don't know how much people, like when I did those interviews for my book, people really drew a very straight line between not trusting the healthcare system and not seeking medical care. It was very obvious from those interviews that people went straight from not trusting to not seeking medical care, and they had bad health outcomes as a result. And so I think just drilling that into the minds of people in the healthcare system a little bit more so that they realize, like, a doctor is not going to be able to get someone vaccinated who doesn't trust the healthcare system in many cases. And so, not working on that issue is working against the metrics that you're trying to accomplish.
Aaron, one thing I do want to indicate here, though, which is potential another, intervention that has some positive benefits, is intermingling the health community with the other trusted parts of our society for those populations. I mean, particularly, for example, in the Black community, the Black church is extremely important to a very large segment of the population. And so one of the things that we did successfully was to take the health professional and have them sit side by side with the pastor and then go through these issues. Not have the pastor saying to the congregation, I want to introduce you, Dr. Tuckson, and then the pastor goes back into the congregation. The pastor stayed right there, shoulder to shoulder, and begins to say, I'm in this with him. And that we start to integrate those things. I think having those kinds of things, again, finding the right thing for different population groups, but intersecting the health people with those trusted parts of a particular population group becomes one of the tools of the many tools that we have available.
So here's a question which comes from, both questions, I think, which were put into the Q&A as well as some of the chatting that's going on. So misinformation can be sort of a loaded term in the sense that it's grounded in the neutrality of whoever is using it. In that, is neutrality a reasonable expectation for someone who's addressing misinformation? And if so, how do you get people to establish that level of neutrality when they're giving information so that people understand that, that they're trying to be a good judge?
Well, I don't know what, the idea. First of all, these two questions that you have here, and then this other question that I see, and I'll just preempt it by saying, if you're going to have trust quality measures for doctors, there should be a penalty for bad actors who intentionally spread misinformation. The experience in California was very, very important. And some of you will know that case where there was a bill that was going to be signed by the governor of the state of California that would have penalized clinicians who spread misinformation. We know that bill was supported by one of our most prominent of our medical societies that pushed for that as well. The issue and the thing that came back was, how do you know at any point in time what is misinformation and what is not? Given that, as we've talked earlier in this conversation, that the things that we know for sure need to be studied, and it takes time. So at what point do you draw the line and say, this is misinformation and this is not? And so that is a very challenging issue. And as a result, they were not able to hold clinicians accountable because this is a moving target. So neutrality, I appreciate neutrality in the sense of giving information to a patient, that's just straightforward, completely objective, not trying to get folks to do one thing or other. But let's just take if somebody has the potential of a horrible disease with a horrible outcome, and you know that if they were to change their behavior, that they would save their lives. Or if you know that a kid needs to be, and there's no question that we have the evidence around whether or not our children need to be vaccinated from preventable childhood illness. That's not neutral. I think that, we've got to be very careful about what we have to be very careful and continue to press ourselves over what is our moral obligation and responsibility. If I know and I have learned, and the science is clear, that if a person does a thing, it will harm themselves or their child or other, do I have then a moral obligation to sort of say, well, make the decision you make. I'm not going to try to tell you what I think you ought to do. I'm going to be like neutral. And I don't care whatever you decide. Versus can you have that conversation with the person that allows you to be clear about your understanding of the science, clear about what you hope they do, but not doing it in a way that causes them to say, well, I have no confidence in you. You're a bad person. You're not listening to me. You're not listening to the reasons why I am struggling with this decision. You are very dictatorial and high-handed and so forth and so on. So I think there's a balance in there some way where there may be some issues where you can be neutral, especially where the science is unclear, and be able to say, I don't know the answer. Let me be transparent. Here are the elements that cause you to think about it this way. Here are the elements that cause you that way. There are contexts in which that is more than appropriate. But the one thing we would not let do is to have a mother let her child walk off the street corner in the middle of a green light.
I think this is a very challenging area and something that we discussed a lot at Critica when we started our most recent study on reproductive health misinformation, because our infodemiologists, who are just basically interventionists, were asking, should they intervene on when there's something about like an herbal remedy that's not necessarily harmful, but it's not evidence-based, and is that misinformation? And we would get into these whole discussions about, well, what if something is kind of like a gateway to believing in more misinformation? And so there is this phenomenon where people get sort of pulled in to, especially on social media because of the algorithm, they get pulled in once they start following some herbal remedies, then they see more and more misinformation, and it can be more and more harmful. And the threshold that we would usually use is the piece of information misinformation? Is it incorrect? Is it prevalent and consequential? So is it something that you're seeing a lot of, and is it consequential in terms of health? Like, is it something that could have an impact on somebody's health and their health outcomes? But that's not to say that these other kinds of claims, like I was just talking about, like, try this herbal remedy for your STD, are not harmful in their own way, because they pull people into sort of an alternative viewpoint that can be a gateway to more misinformation. So I think, it can, like Reed was saying, it's very, very challenging to draw the line.
I'd like you to get this next question first, and it comes from one of our participants in the Q&A. Should and how should health experts acknowledge past errors? And can that be woven into sort of a discussion of the importance of accepting uncertainty?
Is that
You want me to,
yeah, go ahead, please.
do you want me to answer this first?
Yeah, sure. Go ahead.
Oh, okay. So so did you say healthcare professionals or
No. Experts, just experts. In other words, like
Oh,
people,
okay.
I mean, if we were taking COVID as an example, like there were all kinds of people, public health, politicians.
Yeah.
Like, how do you acknowledge mistakes?
I do think that they should acknowledge mistakes, and places where maybe they were where they expressed more certainty than they should have. That happened a lot during COVID. But it wasn't really anyone's fault. I mean, I think that's the big thing about it. If they don't say anything, then they look more guilty. If they sort of say, look, I know that, I made it sound like it was more of a slam dunk than it actually was, but here's why, I didn't know that. Then we do much more of a service to building trust. I think people are afraid to open, like they feel like they're opening a can of worms. but they're actually probably making things better when they leave these things unsaid. That's when people stew and build in their distrust. So I do think that there's a time and a place for that. Um, and that I think if some healthcare experts started to do it, then, and more people started doing it, then maybe it would become more of a normal thing to see happen as kind of a referendum when there's a big health event like a pandemic.
I think that the time and the place comment is extremely important. Yes, we have to be transparent and open about our behavior, and we have to be self-critical. Just know, though, that every time that we do that, the forces of disorder will latch onto every admission and use that as a justification for why you should not listen to us ever again. So that, in other words, you can do as much harm through that process as you can have benefit. I know, for example, I'm very transparent when I'm on some of the radio shows that I'm on now, particularly as with audiences that I address regularly. This time around, since after the pandemic, I actually say to the person that disagrees with me, I used to wag my finger when I would disagree with people who said what you just said. And you know what? I was wrong. So let me listen to you more carefully, and let me try to make sure I understand where you're at. But at the end of the day, let me say to you that I would hope that you might see this issue differently if I give you this information. So what I'm saying is that I am more than prepared to say that there were times when I was a little too energetic, probably those times after I had looked at the death rates and realized, how many people had died that day from the disease. And it was very difficult to be dispassionate about trying to save another 10 that day. But I think we have to be transparent about it. But, look at what's happening with Tony Fauci. Now, how in the world can people decide that that there's some kind of an ethos in this country that assume that Tony Fauci had negative or bad intent in all the things that he did. So that to be able to sort of say, look, I'm in this horrible position. I've got to make recommendations. I've got to give advice. I've got to do the best I can in real time with the body bags building up. Could he have done some things differently or said things, and we supporting him have done that? Sure. But I guarantee you that any admission of failure will absolutely open the floodgates for all they will do is say, see, he was wrong, 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 wrong. Never listen to NIH again. And that's the risk of doing it. But still, we have to do it.
Yeah, I'm glad you ended that with "we have to do it," because right at that point, I was sort of like, I hear you, but I feel like that the running thread throughout this entire conversation is that the biggest problem we have is the tribalism, the distrust, the unwillingness to sort of grapple with those who disagree, and an unwillingness to sort of budge, that it's almost more important to win than it is, or to be right, than it is to achieve the communal goals and the shared sense of sacrifice we all have. And I'm struck by the fact that probably a willingness to be vulnerable and engage, truly engage and listen and empathize is more important than any kind of trick that we may learn about how to post or communicate to trying to make this whole situation better.
Yeah. And I think also from that I think we also have to have now a sense of humility about what we can and cannot achieve. I think the conversation now is different. In the midst of the battle where the bodies are falling, it is very difficult to be dispassionate. It is very difficult to, you just have to do the best you can. I think now we realize that we are at a different place in America. Just as Sarah said, we can't do whack-a-mole anymore. Yeah. What the point being is, we're not going to win this anytime soon. Let's just be clear that this is going to be a long struggle. And so what I think we have to be prepared to do is to engage in that struggle over a generation. This is a generational fight now. None of us have the ability to really make an overwhelming, transformative impact in the next 5 years, 4 years, 3 years. This is going to be tough. So what I'm getting at is we almost have to give ourselves permission that says, look, we may not get to the place we need to get to where we can have folk make better choices and decisions that will help save their lives better, help protect their children's lives better, and protect the health of communities better. We're not going to win that the way that we used to imagine in our minds that we could or should. We're going to have to realize that our ability to do what we want to do is limited, and it's going to take time. And as long as we give ourselves permission to do that, we can have the bumps and the ups and the downs, because that's all that we are. That's the reality that we're in today.
Sarah, I want to give you a chance to have the last word here, even though we are a bit crunched for time.
Okay, I'll be quick. I thank you, Reed. I agree with everything you said. And I would just add that, I think these issues are really obviously really, really tough, and we're not going to figure them out here in an hour or anywhere else in a webinar or in a seminar. But I think it's going to take a lot of advocacy. And I really do think that people in the healthcare environment, including providers and physicians, need to be involved in advocacy to counteract misinformation and build trust. And I think that they need to realize that it is their lane to be involved in that. And that, they're just as important as anyone else in making sure that there's real change.
Well, I appreciate that. And if I can make a 2-second plug, we at Academy Health actually have a 4-week online course called Communicating to Build Trust, which is designed to empower researchers not to shy away from public communication, but to confidently step up to make a meaningful impact in their work. Sarah is actually one of our course faculty, and joined by 3 other experts who cover important communication skills to combat misinformation, including data visualization, use of social media, and media relations. But thank you to both Reed and Sarah for sharing their insights on this important topic, and to everyone who joined today. We hope that this information will, help to address misinformation, as well as bolster efforts to improve the way that we do discussions and all kinds of health and healthcare. Thank you to the ABIM Foundation for supporting this work. Those who have joined today, you will get a post-webinar survey at the conclusion of the session. Please do take a couple minutes to share your feedback in the webinar, because we always want to make things bigger and better. And absolutely have a great day. Thank you so much for joining us.